Welcome to this visual journey on the future of medical communications. How will our field change in the next 5 years? And what are the top skills needed to be prepared to lead that change? We're going to touch on several areas we all need to hone to be well positioned for the future. Over the past month, we spoke with ISMPP leaders and integrated member insights from a recent ISMPP discussion forum posted in ISMPP Connect. And then, a professionally trained graphic facilitator assembled all of the input, reviewed and categorized it, and helped bring this vision of 2025 to life. While the answers may not surprise you, what will is how consistent the comments were and how much we need to refine and enhance our skills and knowledge to be equipped and be ready to lead in the future as medical communication specialists.
Now, as we think even further to the future and some of the happenings that have occurred secondary to the global pandemic, I think that publication professionals will have an even broader remit to make sure that they're leveraging technology and other methods to make sure that data is understood, to make sure that data is translated and it's available in multiple channels and modalities for healthcare practitioners as well as other stakeholders.
But then combining that knowledge with their skills in storytelling, understanding of how to reach audiences, and the embrace of emerging technologies such as virtual and digital. And instead of the current glacial pace of publications, those leaders will be responsible for more rapidly and transparently disseminating data directly to physicians and even patients.
Moving the physical booth lock, stock and barrel, walls and all, onto a virtual platform is fundamentally wrong and not disruptive enough. We should be using the virtual space, in my view, completely differently. No longer bound by the limitations of a physical booth, we could do some amazing things in this space.
I believe the technology that will have the greatest effect in disrupting our current view of medical communications is AI. We've barely begun to scratch the surface of the potential, but at some point, we'll be able to tease insights out of volumes of data we could never assimilate otherwise. Patterns will become apparent when viewed on a macro scale that our eyes wouldn't be able to see.
We've heard murmurings of the importance of plain language summaries and engaging infographics for years. But I genuinely believe that there is now a real appetite, and from patient organizations and patients themselves, a real demand for these types of publication enhancements.
I think one of the things we need to think about in the future is putting together some guidance around preprint and preprint servers to ensure that that information, to the best of our ability, is accurate.
More than that, open access is really important, not just for scientists, but actually for the wider world. And I think this is where open science becomes citizen science, which becomes real engagement from patients and from wider society.
I'm hopeful that the greatest change we'll see is in access to information. I think one of our most critical responsibilities is ensuring that all of this content that we are creating and delivering based on research is put into the hands of those who are going to use it, particularly healthcare professionals and also to patients.
This is our opportunity to lead. Our role will expand as we pair our scientific knowledge with skills in storytelling and an understanding of how to reach audiences to more rapidly and transparently disseminate data directly to physicians and patients. We will move from a linear publication model to concurrent multi-channel communication streams. Our work will be less about tactical than strategic planning, and less about volume than precision targeting. It will be visual and audience-friendly, and we will work directly with digital strategists to leverage emerging technologies to become even stronger communicators. And we can't wait to see where each of you will lead our profession in the coming years.